Sir, class, today you will now brief the class on his presentation, Life Skills, Brushing Teeth. Before I continue, I apologize as I will be on and off the camera in order to change the slides during the course of this presentation. Without further ado, I will begin my presentation. Life Skill, Brushing Teeth by Cadet Eugene Youth. Today's presentation will cover the following questions. I will give you 10 seconds to read the questions above. Of the questions you see before you, question number 4 is the most important question to be discussed during the course of today's presentation. Question 4 states that, how should people brush their teeth? Brushing your teeth is an important habit to have, and it's also one of the more important habits due to the fact that it preserves your permanent teeth that you have in your mouth. I will be discussing the background of what teeth are in the next slide. Teeth in general. As children, we are born with 20 teeth before we lose them, and we have 28 permanent teeth in our mouth, give or take if you lose your wisdom teeth. Now, on the picture to your left, you will see that the teeth in our mouth consist of canines, molars, premolars, and incisors. These are the many different types of teeth located in one's mouth. In addition to these teeth, it's also important to recognize how a teeth connects to the main jaw of a person's body. Now, each tooth actually is located in between two sides of tissue known as gum and are placed inside the jawbone with a portion that is above the gum, which is the crown, and a root that goes all the way down into the jawbone itself. Now, teeth are made out of calcium, and although they are a very strong material and one of the strongest in your entire body, they're very susceptible to unsatisfactory life choices, and practices such as not brushing your teeth or eating highly acidic food can often wear down the teeth and make you more susceptible to unhealthy teeth and decay. The next slide will discuss what makes a healthy teeth. As you can see in this picture, healthy teeth are often characterized by smiling, and smiles often show that clean teeth are white, smooth, and without any definite impairments to the person's teeth. However, although teeth are white and need to be strong, often this can be indicative of something a little bit underneath the surface. In other words, although your teeth may be white, you might not be brushing correctly, and likelihood your teeth might be hiding something underneath the surface of the whiteness that you see. On the other hand, unhealthy teeth can be categorized by the following as you see on this slide in front of you. There can be decay, gingivitis, cavities, and even infections. However, in this picture, I apologize due to lighting, you might not be able to see this. However, there will be times where the enamel itself will look very glossy, but also parts of teeth where they're just bleached white. And that's known as decalcification. Decalcification shows that the overall teeth may be white, but parts of the teeth are already so weakened that the areas where it's decalcified are more likely for decay. So when the decay occurs, you can get cavities, and cavities can cause infections, and infections of the teeth itself can cause inflammation of the gums, which lead to gingivitis. As you can see, the teeth are not as strong as you might think, because good lifestyles will either preserve the teeth, or bad lifestyles will often hurt the teeth, and the teeth themselves will begin to wear away and also literally rot away as well. The next slide will show you the unhealthy teeth continue. Oftentimes, you'll notice that cavities occur along the surface of the teeth. And although cavities can't occur on the surface, they can occur in between the teeth, on top of the teeth, or even below the teeth as well. And this is based upon what you can see. But below the surface, a cavity can have much greater impacts, such as having an infection of the entire tooth itself. As you can see in this picture, these are all blood vessels But then when there's a cavity, there's a likelihood that the cavity itself can cause an infection down way below to the deep roots of the teeth as well. This will prompt the need for dental operation, and that operation is known as root canal. And stereotypically, many people think that root canal will be the automatic go-to treatment for people with cavities, but that's not the case, because extreme cases of cavities will cause infections, and infections will necessitate a root canal. But nonetheless, as a deterrent to brushing your teeth, and actually not as a deterrent, but as a supporting my claim to needing to brush your teeth, it's important to realize that if you do get a cavity up here, the dentist will drill out the entire top, which often includes a lot of nerves, and then will clean down to the root and put a cap on it. And although this is the root canal treatment, it's not a 100% chance that that infection will be cleaned out forever, because if you continue to have unhealthy lifestyles, this entire issue can come back again. So that is why brushing your teeth is extremely important, because it can reoccur based upon what you decide to do and how you want to treat your teeth. So for my next slide, we'll discuss good oral health. The purpose of this presentation was to understand that brushing your teeth can have good long-term effects towards your health as well as your lifestyle. Now, when you buy a toothbrush, your toothbrush can either come in manual or electric. Both of them don't make much of a difference in terms of cleaning, because cleaning itself is dependent on the consumer itself. Well, if the consumer is more comfortable, then whichever product makes the consumer more comfortable will be the one that will be used more often. For this purpose of this presentation, I'll be discussing the manual toothbrush. And manual toothbrushes are often in many different types of colors and designs. But the most important characteristic you need to consider when purchasing a toothbrush is getting one with soft bristles. Soft bristles are important because hard bristles will often wear away the teeth itself and are not very effective. So be sure to purchase a toothbrush with soft bristles, which is about 100% of every toothbrush in the market, and also purchase them 2 to 3 months in intervals. You see, having only one toothbrush per year is often not good for the person's teeth at all, because the toothbrush itself will wear down over time. And when it wears down, the bristles on the teeth will start to flatten itself out, and that will go to an ineffective clean, and that's when you need a new toothbrush. So, bottom line, there are plenty of toothbrushes in supermarkets that have soft bristles, but it's also important to change them every 2 to 3 months as they can wear down. Also, purchase toothpaste with fluoride paste, because fluoride often strengthens the teeth's enamel and will give you a better smile and the clean that you would like. Moving on. In order to use the toothbrush correctly, the following is some tips to make sure that you brush your teeth correctly. This is rather wordy, so I will direct your attention to bullet points 3, 4, and 5. Now follow along as I read them to you. Apply light pressure in a circular motion for about 15 to 20 rotations. Make sure you brush for about 2 to 3 minutes. Note, gently brush your tongue and the inside of your cheeks. This is very important because not only do you brush your teeth in a straight line manner, but then by brushing your teeth in a rotational manner, you can gather more surface area while also getting a deeper clean. At the same time, brushing your teeth for only 30 seconds will not be enough to clean your teeth thoroughly. Therefore, it's important that you clean your teeth 2 to 3 minutes at a time per session. And as you clean your teeth, brush your tongue and the inside of your cheeks. This is something that I've learned in my experience, but your tongue, like if you have bad breath, you can taste your breath kind of. And that's because there's a lot of bacteria on your tongue as well as on the insides of your cheek. So a lot of times, toothbrushes will have a tongue scrubber on the back of the head of the brush. And that will be your tongue cleaner to clean off that bacteria as well as your cheeks. And that'll often give you a better feel for the freshness after you clean your mouth. And make sure you rinse with water or mouthwash for a further clean, and also rinsing away the paste that comes out. So, the following diagram shows you how to correctly brush your teeth. Brushing your teeth in a 45-degree angle manner will not necessarily the best way, because 45-degree angle means that you're tilting your brush too far down. So I recommend that as long as you brush your teeth in a manner that does not hit your gums, that's the best way to go. Because if you brush alongside your gums, most likely you'll get a receding gum line, which is not good and will cause bleeding. So to avoid that, just brush along your teeth, but not along like the top over your gums as well. Also, make sure to brush outside and also inside of your teeth, top and bottom, because cavities, like I said before, can occur anywhere 360 of the teeth itself, on the surface of the teeth, that is. And so cleaning everywhere on the surface is very important as well. Now, you might be wondering, why do we brush our teeth? Besides having a better smile, what else benefit can there be? The following slide, as you can read, has many benefits to brushing your teeth. Remember, brushing twice a day is the recommended amount of times of brushing, but I personally recommend that brushing after meals, if you have time, is the best way. Because often when you have food residue in between your teeth, that's a perfect chance for bacteria to form, and bacteria will often cause plaque onto your teeth. And that plaque can often become like tar, not tar, but some kind of solid matter stuck on top of your teeth that will continuously get bigger and bigger and often cause the cavity later on because there's food residue. So brushing your teeth after you eat meals is a great way to preserve your teeth, as well as going beyond the recommended amount to have better oral health. Also, be sure to floss. Flossing is very important. I'm pretty sure many of your dentists have told you. But flossing itself will often get those food residue and will avoid gum diseases. Sir, class, this concludes my presentation on the benefits of brushing your teeth, a life skill.